everyone, welcome to another episode or video with Code Rhetoric with Tam Talk. I am Tam talking. So on today's video, I want to talk about storytelling, using codes to tell a story, and that's pretty much what coding is. Medical coding is. It's telling a story to I would say like the insurance payers or to those uh, specific parties that are involved in the care of a patient. And so what you are doing is taking the services as well as the diagnosis that were performed or provided within a particular encounter between the clinician, and the clinician is could be the nurse practitioner, mid-level provider, and of course the physician and the patient. And so what you're doing is taking all of again those services as well as those diagnoses, and you're creating a story, or you're telling a story in the format of a claim to the insurance company, or again to those parties that are specific to the encounter of that patient. So whether that patient is referred out to a specialist or to again the insurance company, you want to be able to tell the story with your coding. So a good example of that would be is I'm going to use the example of colonoscopy, right? A colonoscopy, and then along with the diagnosis. So, for example, if I'm a surgical coder and I receive or I am presented with a surgical report, operative report that is specific to a colonoscopy procedure. So during that procedure, the first thing that I'm going to do is look at why they are performing the colonoscopy, and this is what leads into the medical necessity. And when I say medical necessity, like the reason, the diagnosis, why are they doing this? Because let me pause here and go back. Your coding is incomplete if it does not have a CPT or an ICD-10 CM code. And what I mean by that, because your ICD-10 CM code is your diagnosis, is also the reason why the patient is presenting to the healthcare provider for a particular service, whether that be surgery, whether that's just an office evaluation, examination, what have you. Again, if you don't have the reason for the encounter, or if you don't have the diagnosis, then your coding is incomplete. So again, we're going to go back to the colonoscopy. So why is the patient presenting for the colonoscopy? Is it because they have a diagnostic, or and when I say diagnostic, I mean, is there a legitimate illness or some forms of signs or symptoms, or is it a screening colonoscopy? Because not to get too heavily involved in it, but of course with Medicare, patients reach a certain age and they are, prone to possibly, I would say, get cancer. Don't quote me on that. I'm not a clinician, but long story short, Medicare, offers screening colonoscopies, right? So, is the patient of age to where they are entitled to receive a screening colonoscopy? Is there a family history of colon cancer? There are so many reasons why, or other specific reasons why the patient may be presenting for a colonoscopy. So when I say diagnostic, it could be the patient may have some form of signs and symptoms such as rectal bleeding, right? So in that case, you want to, again, figure out why they are presenting for a colonoscopy. And once you determine that reason or your diagnosis code, then you will proceed to the operative report, which is the body of the note. Excuse me, guys. The body of the note. And so you want to look through that, you want to review the operative report in its entirety. Again, you want to review the operative report in its entirety, because things could change, switch up, new findings within the course of the encounter of the surgery. And so let's say in our case, the patient, the colonoscopy was complete. There weren't any additional findings. In that case, we want to code, which I would say our CPT or general CPT is 45378 for a colonoscopy. That's excluding biopsies, any polyp removals or anything like that. The doctor is just doing a diagnostic examination of the colon. And so the medical necessity is we're going to say I'm just going to say rectal bleeding, right? So we know our diagnosis or our ICD-10 code is rectal bleeding. We know the procedure is a colonoscopy. So what our code should tell the person or the payer is that the patient presented to this doctor or to the surgical suite for colonoscopy because they had rectal bleeding. What was the final diagnosis? We're going to assume, again, it was just rectal bleeding. However, your final diagnosis may change because it could be the patient had a polyp. The patient could have cancer. We don't know. So whatever that final diagnosis is, that is the reason why the colonoscopy was performed. That is the medical necessity. Okay? And so again, your coding should tell a story of what transpired during an encounter with a healthcare clinician. So that's storytelling. So that's really what coding is in a nutshell. Being able to tell a story with codes. That's all it is. Being able to tell a story with codes. So, there are like many diagnoses and maybe many procedures, but again, medical necessity comes into play. So you want to make sure you're not lying in your story, right? You're not fabricating in your story. Again, that's where medical necessity comes in. It is painting a picture, it's telling a story, but you're doing it with truth and integrity. So that's my perspective or how I look at medical coding. And again, medical coding is storytelling in a nutshell. So that's all that I have for this video. If you're not a subscriber, be sure to hit that subscribe button. If you have any comments, feel free to comment. I always review those and respond back. And yeah, so look forward to another video coming in the near future.